Hi, this is Dr. Robert Chao reporting live from ACR 2021 for Room Now. I'd like to share with you some of the best abstracts focusing on spondyloarthritis here at day 3 of ACR 2021. And today's theme really focuses on the extra-articular manifestations of especially axial spondyloarthritis. And there's 2 abstracts I want to shine. And the first one's 1324. And this was a study looking at uveitis in over 300 patients with axial spondyloarthritis. They found that at least 14% of patients with axial spondyloarthritis developed at least one episode of uveitis. Typically, these episodes were acute, anterior, and unilateral in roughly 93% of the cases. These patients were also noted to have a higher prevalence of HLA-B27. This actually reminds me of a talk from Room Now Live earlier this year, where Dr. Robert Wang discussed uveitis and mentioned that actually all uveitis patients with hypopion will be B27 positive. The second abstract is abstract 1311, which looked at the prevalence of psoriasis in axial spondyloarthritis patients in a French 6-year prospective cohort desire. And over 6 years, they found that the prevalence of psoriasis increased from 16% to 26%. And they also found that psoriasis may appear at any point. They also found actually that psoriasis did not appear to affect any axial spondyloarthritis outcomes in terms of functional capacity and disease activity. I think these 2 abstracts are very important for us because sometimes we need to step aside and not forget that the diseases that we treat, especially spondyloarthritis, have a lot of extra-articular manifestations. I try to make it a personal endeavor to ask these kind of questions at every patient visit, especially patients who are relatively quiet in terms of disease activity, to make sure we're not missing any episodes of uveitis or new occurrences of psoriasis. So thanks for tuning in. For live coverage of ACR 2021, visit roomnow.com and follow me on Twitter at Dr. RBC. Thanks.